Well, I'm the executive director of Network Lobby for Catholic Social Justice and have the distinct honor of being the leader of Nuns on the Bus. Here we are at the Rally for Healthcare. Healthcare, once again, is on the ballot this November's election. We know it's on the ballot because we know who we elect matters. And Nuns on the Bus has been engaged in healthcare, or I guess I should say nuns have been engaged in healthcare for a couple of centuries. Sisters were the first nurses in the 1700s down in New Orleans. Sisters nursed on the battlefield of the Civil War on both sides of the fight. Sisters have been involved in healthcare through health systems, and as you may recall, in 2010, sisters were involved in the political struggle for healthcare. The Catholic Health Association, Sister Carol Cahan, who was their leader at the time, came out in favor of the Affordable Care Act after a bunch of political fights. Network, Lobby for Catholic Social Justice, we wrote a letter that was signed by 59 Catholic sisters who were the leaders of their congregations. This was cited as being critically important for the passage of the Affordable Care Act. Now, there's a little detail that I left out. Between Sister Carol's supporting that bill with the Catholic Health Association and our letter supporting Sister Carol and the bill, the Catholic bishops came out opposing it, opposing the Affordable Care Act because they got bad information. Their staff had told them that there was federal funding for abortion in the Affordable Care Act. Well, after a couple of years, a couple of federal courts had said absolutely there is no federal funding for abortion in the Affordable Care Act. The bishop's staff was just plain wrong. But the good news was that our letter and the Catholic Health Association helped move the Affordable Care Act to victory. We know that the Affordable Care Act is not perfect, that we need to improve it, that there's much to be done, and we'll talk about that this evening. But then in 2012, the beginning of Nuns on the Bus actually got started because of our healthcare stance when the bishops, the Vatican, took the bishop's position and said, oh, network is a bad influence on Catholic sisters. Well, what I knew was it was politics, and we just stayed focused on mission. And our mission at that point was to defeat the Ryan budget and to protect healthcare for our people. 2012, that was it. In 2017, you can remember that there was this big effort to repeal the Affordable Care Act in House and Senate. Oh my glory. We had a 24-hour vigil out on the lawn of the Capitol. We had people flying in to talk to their senators. We did everything we could. And partially because of the work of sisters, we were able to defeat that effort. I know Senator John McCain gets a lot of credit for being the tipping point when he came into the chambers and put his thumb down and said he wasn't voting to repeal it. But actually, my heroine was Senator Lisa Murkowski, who stayed faithful in protecting the ACA through that whole fight, that whole night. She told us that she wanted to support her people and that she knew her people in Alaska needed the Affordable Care Act because she met with them, she'd heard their stories. So now here we are again, fighting it as the Trump administration, in the midst of a pandemic, continues to pursue their case in the Supreme Court. Who we elect matters, as my sign says, and how we vote in this election season will make a difference. So tonight we're going to have two panels. I'm really excited about this. The first panel are three women who understand the challenge of healthcare and how it has impacted their families, their friends, their loved ones. And then after we talk about the real live experience, then we're going to talk with some folks who work on policy. What can we do to make a difference? How do we move this forward? Okay. Now, this also is in keeping with Pope Francis's new encyclical, where, the new letter that he wrote to the world, where he said, ground your policy in the experience, the encounter of people. That's what we're doing tonight. So let's invite in our first panel. We have, let's see, Elena Hung, from the executive director and co-founder of Little Lobbyists, Laura Packard, a great ally from Healthcare Voices, and Kristen Urqueza, who is fairly well known nowadays for being this amazing voice for Marked by COVID, whose family has been so impacted by the virus in this pandemic. Welcome to all three of you. Thank you for joining us.
Thanks for having me.
Oh, it's a delight. So why don't we maybe just go around and hear each of your stories, and then let's have a conversation about the impact of this reality of healthcare vulnerability that we all experience. So, um, Elena, do you want to start us off with your experience?
Sure. I will. Thank you, Sister Simone. And hi, everyone. I want to say it's great to be here, join you all. And at the same time, it's kind of hard to keep fighting for this, but that's what we do. And we're all here together. And that brings me a lot of hope. So I'm Elena Hung, and I'm a mom. And about 6 years ago, I had a great pregnancy. I had an amazing birth. But then 15 minutes after my baby was born, she was placed on 100% oxygen support, rushed to the neonatal intensive care unit, where she remained for the next 5 months of her life. She was diagnosed with a number of serious medical conditions affecting her airway, her heart, her lungs, and her kidneys. And I named her Xiomara, which means ready for battle. Definitely that. She is the joy of my life, and I am so lucky that I get to be her mom. I'm thrilled to tell you that Xiomara is thriving today. She is happy, kind, funny, clever, a little bit naughty. She graduated from kindergarten last spring. She's in the first grade right now. She celebrated her 6th birthday this past summer. These are 2 milestones that we never ever thought we would see, that we were never guaranteed, and that I'm forever grateful for. And that's because of our access to healthcare, and specifically to Medicaid. So I share all of that as my personal story, but also because there are countless families like mine across the country, countless of other Little Obvious families like mine as well, who also rely on healthcare to survive and thrive.
Wow,
Yeah.
thanks, Elena. And it's so exciting to hear about your daughter's growth and the fact she's in first grade. I can't believe it.
I
Whoa, so
know. I
sweet.
mean, you've watched her grow the last 3 years, and so yeah.
Exactly, exactly. Wow.
Yeah.
Laura, why don't you tell us your healthcare story?
Sure. It's a pleasure to be back with you and Elena Hung. We were all together at the close of 2018, but it's not a pleasure to still be talking about the attacks on our healthcare even today. 3 years ago, I was diagnosed with stage 4 cancer. And the day after my first chemotherapy appointment was when Republicans in the House voted to take away my healthcare. All through that summer, I would be going through chemotherapy every couple of weeks, and every day there would be a new Republican attack on our care. I first met Sister Simone when she came through on the bus in 2017. I'm still here, but their attacks on our care are still here too. And now there's going to be a Supreme Court case the week after the election to decide what happens to the Affordable Care Act and 135 million Americans with pre-existing conditions like me. And the millions of Americans going through COVID-19 now, they also may be uninsurable if Trump gets his way and destroys the Affordable Care Act. They keep pretending to have plans to cover people with pre-existing conditions, but when you actually look at the plans, they are as trustworthy as a Trump University degree. So here we are again, still talking about attacks on our care because the attacks on their care are very real.
Oh my gosh, they're all too real. And we'll talk some more about that after we get going. But Kristen, please, can can you unmute yourself and then join us and share your story that is more about the challenge of COVID now, which adds a whole nother wrinkle to this struggle.
Yeah, no, I'm happy to be here. And it's so great to meet you, Sister Simone, Elena, and Laura, to be with you here. My name is Kristen Urquiza. I'm co-founder of a newer organization called Marked by COVID. It is a advocacy and campaigning platform working to help uplift stories of folks who have been impacted or marked by COVID and really demand better healthcare as well as a coordinated, data-driven response to this pandemic. What brings me to this universe is because I lost my own dad to COVID-19 on June 30th. My dad was an otherwise healthy 65-year-old who did not consider himself old by any stretch of the imagination. His father lived to be 90. My great aunt, his aunt, is just turned 91. So we come from a very healthy stock of individuals. My dad, he suffered for 19 days. And honestly, he was lucky to have access to healthcare, but he wasn't lucky enough to have access to the type of cautionary care that we're seeing others get access to right now. When my father came down with symptoms similar to that of the president of a low-grade fever, cough, and chills, my father went to the hospital and was told to come back if and when he couldn't breathe. 5 days passed before he reached a point where he couldn't breathe, and we took him back to the hospital and were never able to bring him back. I think that this story really highlights the two pathways of healthcare in this country, one for the haves and then one for everybody else. And that is why I am so happy to be here today to have this conversation with you all, because above all issues on the ballot this election season, healthcare, our COVID response, it's all the same and it's all on the ballot.
Kristen, and I'm so sorry for your dad's death and for the impact on your family. It must be especially difficult when you see how the president gets all this special treatment, and he's someone's dad too.
Yeah.
But that your dad doesn't have the same equitable care. It's painful. It's painful. I just want to acknowledge that part.
Thank you. I appreciate that, sister.
Wow. But so for each of you, healthcare is personal. I mean, and I wonder if we could talk a bit about the kinds of difference. What kind of difference does it make in your life to be able to count on healthcare as opposed to not having it? We talk about how that is. I think, Kristen, maybe we could start with you, because you speak it's so clear with your dad. While he had it, there wasn't enough care, not like the president's care.
Absolutely. Yeah. I mean, and the type of care that my dad received, I felt grateful for the fact that, I didn't have to worry about a ton of bills coming in after his care was taken, after his stay in the hospital. But that being said, the entire time he was under doctor's watch, I had a difficult time getting a hold of the doctor to see what his diagnosis was, what the course of treatment was. And this is because our healthcare system is so strained right now, with so many people going into the hospital for COVID. And that has caused so much anxiety and anguish for me and my family, to not be able to be there by his bedside and to advocate aggressively. And that's my point. I would like to live in a country where every single person we know is going to be taken care of, and we don't have to be aggressively at their side ensuring that they're getting the best treatment possible. But that is part of the burden for individuals, and also part of the burden I see with families all across the country that are marked by COVID, who might not have the language, the technical language skills to be fierce advocates for their loved ones. And this unequitable system continues to push them farther and farther down the line of care. And that is just despicable when it comes to our loved ones and ourselves.
Absolutely. Absolutely. And it makes me think of you, Laura. Here you were going through chemo and having to advocate and worry about protecting your ability to be treated. I mean, how do you deal with that? How does that work for you? And then how do you go forward in this nervous making time?
Well, nobody should have to live like that, but millions of Americans did and still do. And I'm lucky to be in remission today, but any insurance company that had the choice would never choose to cover me. And if my cancer comes back without insurance, I will be bankrupt or dead. And this is something that millions of Americans are facing. When our healthcare is threatened, there isn't a plan B for a lot of us. I'm self-employed and my insurance is through the exchange. Before the ACA was enacted, I had junk insurance. And I've read stories about the people on that junk insurance that had cancer that then had to sue for coverage, or their families had to sue after they passed away. That could have been me, and that could be me if they succeed in destroying the Affordable Care Act.
All right. I'm getting riled because it's totally political brinksmanship. It's all politics. It's nothing about caring for our people in the richest nation on earth. It's ridiculous. Ridiculous. All right, now that I'm riled, Elena, add to my frustration.
Yeah. Yes. So what I'm hearing from Kristen and what I'm hearing from Laura and what I can say about myself, raising a child post ACA, which we know is not a perfect law, but it has saved so many lives. And then through my organization, Little Lobbyists, I've come to know families with older children. So I know what it was like before the ACA. And to compare those two things, and we're back here in 2020 at the risk of going back there, it's just terrifying. And so we hear a lot about pre-existing conditions. The issue that's closest to my heart that led me to found Little Lobbyists is lifetime limits. So not many people know that before the ACA, insurance companies had a cap, had what do they call a lifetime limit cap, which basically meant once you reach a certain arbitrary number, which is usually $1 million or so, your insurance company could just cut you and you would lose your insurance. So $1 million might sound like a lot of money to some people. And that's a whole other story about how much healthcare costs, right?
Oh, yeah. We'll
Right.
do that next time.
We'll do that next week. Okay. But my baby spent 5 months in the hospital, and the bill for that was $3 million. $3 million for 5 months. And that's before she even came home, before she was even discharged from the hospital for the very first time. That meant she would have lost her insurance had we had the lifetime cap. She would have lost her insurance and would have been uninsurable for the rest of her life. And that's true for anybody who spends any significant time in the hospital. That's true for anybody who has any, chronic illness that requires lifelong care. Any significant treatment like cancer treatment and chemo, you can run through that lifetime limit real fast. And so that's one of the things a lot about when I think about the other Little Lobbyist families with children with complex medical needs and disabilities who will need care. There shouldn't be this system where it's, like Kristen was saying, haves and have-nots. And that's really what I, think a lot about. And Medicaid. I mean, we talk about the ACA. Medicaid helped expand Medicaid. And that's how a lot of families were able to get coverage who were not previously covered. Medicaid can literally be the difference between life and death for some families, including Black and Brown and Indigenous families, especially right now, who are disproportionately impacted uh, by this pandemic. And so I think, when we think about healthcare, it's healthcare across the board.
Absolutely. And I was going to add one more story to this because I carry
Yeah.
this picture of Margaret Kistler,
Yes.
who I met her sister and her sister's partner on the bus in 2012. And Margaret died of colon cancer because in the 2008-2009 recession, she lost her job and lost her health care. And she had a propensity to colon cancer. Their whole family does. But she didn't have any care, and the ACA had not been fully implemented. And she ended up dying because there had not been the expansion of Medicaid. And so for me, I've carried Margaret's picture all these years to say, no more Margarets should die for not having care. So, I mean, it underscores the importance of Medicaid, but also the challenge of having a health system that is both so costly and often routed through employment. And so, like you were saying, Laura, being, self-employed, that makes for an additional burden in as a business person just to keep that coverage. So there's a lot of complexities in this, and I guess what I'm hearing is the layering of need, a layering of problems. Because Kristen, you were saying how hard it is to get to doctors to even be able to find out what's going on. And Laura, the worry that you're going to be able to have care or not have your, insurance taken away. And Elena, the consistent work with your daughter to make sure that she gets the care that she needs. This is complex, but it's not rocket science. It seems like human beings ought to be able to make a difference. So have you thought, I just want to add, I don't know if this question, I just thought of this as we're doing this. What would be one piece that would make a difference for you as you know your story with healthcare? What's one thing that you wish we could do or be, or a way we could be different that would um, make it more just in healthcare in our country?
Mhm.
And whoever wants to go can just do it.
I'd like to talk about priorities because right now they're refusing to pass relief for the people in this country that need it. My sister's been unemployed for months and she's trying, but try to find a new job in a pandemic. So not only are they threatening our healthcare and refusing to pass laws that would actually do something about prescription drug prices or expand healthcare to more people or lower costs for people, not only are they not doing that, but they are prioritizing ramming this Supreme Court nominee through against the will of the people instead of passing relief for the millions of people begging for it. So what I would really like to see Congress and Trump do is focus on that.
Amen. Amen.
I would piggyback on that just to add in a slight kind of thing that keeps me up at night is this priority issue. But also thinking about how you cannot have economic health without public health. Centering our entire response around people and workers and ensuring that they have that care that they need, but that they also do have things like paid time off so that they can take time away to take care of themselves or their loved ones is all part of this equation to ensure that we are helping our society prioritize taking care of one another. And then in turn, that will give the health that we need to our economy. So I talk a lot about this dual sort of this false dichotomy that you have to have one or the other. You actually need public health first in order to have economic
that's such a
health.
good point. And that so gets lost in the current political conversation. Thank you. Yeah, Kristen, that's really keen. Elena,
I totally echo what Laura and Kristen said. And what I'm thinking about is on a more personal level. And I as someone who was at my baby's bedside for 5 months, for 169 days, every day. And I think of you, Kristen, and all the other families who are trying to be there. And what we really, really want is to be able to focus on our loved ones, to focus on our own health and our loved ones without having to worry about how to get care. And it's magnified right now as we watch the president, as we watch Chris Christie, as we watch all of these wealthy, privileged politicians, the haves, be able to get rapid testing every single day, be able to get everything they need and not think about it, not worry about it. That's just so unfair. Healthcare shouldn't be about that. In a time of need, we should be able to focus on ourselves and be able to focus on our families and care with them and be with them. And that's really what I think about every day. Like, I don't know how I would have made it, how my baby would have made it if we didn't have each other in that time of need. So this isn't, specifically about policy or politics, but I think about the humanity of it all. If we're not here fighting for the humanity and the dignity of life, then what are we doing? What are we doing? Right?
Wow. I think you each put such a clear focus on that healthcare is a ministry to care for the ill, but also the family, and how we as a nation have gotten into this individualism. I'd never thought of this till this conversation, and how our individualism is tearing us apart. Because, Kristen, you couldn't get to your dad. Or Laura, you didn't have the sense of solidarity with our society that would care for you. You're part of us, that we're woven together. Or Elena, that sense of family connection and support. Well, maybe that's what we have to become, missionaries for creating this bigger sense of family and community and connection. I really thought that COVID-19 might do it, but I guess we haven't made it. We only have like 2 minutes here to finish up before we move on, but I just want to say thank you to you for lifting up this fact that, yes, it's healthcare, but it's communal care. And it's caring for us in this bigger context. And I think, Laura, using that word priority, that we need to give priority to the community that we are. I'm going to carry that away. And hearing Kristen, thinking of the families that struggle right now because they can't get the same level of access to testing and drugs and support. Whoa, that is like a mirror of the failings of our nation. And Elena, I'll continue to walk with you and your amazing daughter and support you, that you get what you need to be able to flourish as a family. Thank you so much to the three of you for setting this in reality. Thank you.
Thank you.
Now we're going to swap you out for the next panel. Okay, so we're going to have a panel of experts. So we have Nadia Hussein, Nadia is the Maternal Justice Campaign Director for Moms Rising, that amazing organization of moms doing great work all around the country, who we love to collaborate with. And Alberto Gonzalez, who's a Senior Strategist for the Health Policy Project at Unidos, USA. And finally, Emily G., who is the Health Economist for the Health Policy at the American Progress Institute. Welcome to you all. Well, okay, I have to ask you first, just kind of head nods, I think. Were your hearts broken by these stories? I mean, isn't that, our nation is in such a mess that we don't prioritize our people. Oh, all right. Hopefully we're going to make missionaries that are going to go out there and make it. So, as I advertised, let's give each of you a chance to talk a little bit about what you're working on and how you see these policy fights, and then let's have a conversation so we can pull that together. So Nadia, do you want to start us off?
Sure. Thank you so much, Sister Simone. And I would say personally, I've been a fan of Nuns on Buses for a very long time. So it's really awesome to be here representing Moms Rising. one of the parts of ACA that I wanted to really uplift was about the Medicaid expansion, and some of the speakers did mention. I know. I believe it was Elena who spoke about her child being on Medicaid, and there's often this stigma attached to Medicaid that's really false about who is on Medicaid, who's not on Medicaid. But anybody who actually does this work knows that so many American families benefit from Medicaid. So many children benefit from Medicaid. It's so important to protect that. And another point that's so important about Medicaid is that many people may not realize that I think maybe at or over 50% of births in the United States are covered by Medicaid. It is an essential part of ensuring that maternal health is protected, that birthing people are able to have not just a safe pregnancy and a safe birth, but able to go home and watch their children thrive. Right now, before COVID even, there was already a maternal health crisis. The United States has ongoing the worst maternal death rate of any developed nation, and the racial disparities piece is absolutely horrific. Black women die at about 3 to 4 times the rate of white women when it comes to giving birth or birth-related causes, and that's independent of education and age and economic status. And COVID is only in this crisis of COVID. We don't have those stats yet, but one can only imagine that's getting worse. And with all that, with Medicaid expansion and ACA, it's made such a big difference for birthing people. Medicaid expansion is associated with a reduction in maternal and infant mortality. So when people say, oh, they care about life and supporting life, well, if you care about infant mortality, you will care and support Medicaid expansion and protect that. States that have expanded Medicaid improve the health of women of childbearing age by increasing preventative care. They're saying that 60% of maternal deaths, that stat I gave, 60% of maternal deaths could be prevented by better access to preventative care. So that's a very big deal. So many women and birthing people are losing their lives just because they don't have that preventative access. And all this is a really key part of addressing the maternal health crisis. And this is another really important statistic that I hope people take away. States that have expanded Medicaid under ACA, so this wasn't before ACA, it was after ACA, they saw a 50% greater reduction in infant mortality than non-expansion states. And that is just huge about the infant mortality piece. And there are major racial disparities in infant mortality. Black babies on average are twice as likely to die after birth than white babies. One of the things that Moms Rising is pushing and supporting, obviously on top of protecting the ACA, ensuring that the ACA, that these elections go in a way that protects the ACA, is supporting a piece of legislation called the Helping Moms Act, which is the Helping Medicaid Offer Maternity Services Act. And this is something that the Black Maternal Health Caucus has really been championing. We've worked in coalition with many groups like March for Moms, Black Black Mamas Matter Alliance, the Black Women's Health Imperative. And what this bill does is it incentivizes states to extend Medicaid to cover the entire postpartum period after birth. So basically it would expand Medicaid to a year after birth. Right now, I think right now, the majority of deaths that happen from birth-related causes happen the day after birth or later. So a lot of folks don't realize, they think, oh, you had a healthy birth, everything was fine. But actually what they found is in Texas, actually, when Medicaid was cut, a lot of, unfortunately, many mothers lost their lives. So it's so important to do that extension. Another thing that's important with that extension is to push for an increase in federal medical assistance percentages to ensure that states are incentivized to implement this change. Even though we're pushing for this bill, which, by the way, last week just got out of the House, so we're going to be definitely pushing in the Senate. So that's one thing that we are working on, along with our partners who are leading this, but also pushing on the federal level that there be an incentive for states to even take this on. And this is all just tied to, supporting ACA, protecting ACA. Having this fight for years and years is just not working for our country. There's no reason that a human right, such as healthcare, expanding Medicaid, saving the lives, proven to save the lives of mothers and babies. How much lip service do we get about that? about, oh, moms matter and oh, births and babies. Like, how much lip service do we get? But lip service doesn't do anything. Lip service does not save lives. ACA saves lives. Expanding Medicaid to at least a year, not just in the federal. We're doing legislation. There's legislation introduced in New Jersey and other states as well. To expand on the state level, but just
okay. I'm going to have to butt in.
Yeah,
you're a passionate advocate. It's fantastic. It's fantastic. But I got to let Alberto in here. He's the bold man who joined us in this. But we have to, be sure he gets a little space. So Alberto, what are you working on?
Thank you, Sister Simone, for having Unidos US be part of today's conversation, a very important one. Unidos US is the nation's largest Latino civil rights and advocacy organization. We serve and represent the needs of 60 million Hispanics across the country. We work with our affiliate network of 300 community-based organizations across the country in 37 states and in Puerto Rico. And just to build on what Nadia mentioned, Medicaid is so crucial for the Latino community. We believe that everyone should have the opportunity to achieve the highest level of health possible, regardless of where you're from or where you live in this country. It's so key. And earlier in the conversation, we talked about what life was like before the ACA and what life was like before the pandemic. Well, for the Latino community, before COVID hit, the Latino community was already experiencing health disparities. Before COVID hit, about 19% of Latinos were uninsured, compared to around 6% of non-Hispanic whites. And Unidos US partnered with Georgetown University Center for Children and Families to release a report that showed that the Latino child uninsured rate increased in 2018 to 8.1% compared to 4.2% for non-Latino children in 2018. So there was disparities even before COVID hit for Latinos, but in particular for Latino children. And that's why we continue to champion policies and programs like Medicaid expansion that serve the critical lifelines for Latinos across the country. And Medicaid it's important for millions of Americans, but particularly for the Latino community. Of the more than 70 million Americans that are covered by Medicaid, 18 million are Latino. And when it comes to Latino children, more than half of the nation's Latino children get their coverage through Medicaid or CHIP. So it's important that we continue to strengthen the program and work to expand it in states, particularly states in the South where you have high numbers of people of color, Latinos who are uninsured. That's a priority for our organization. And to mention that COVID, we're seeing really troubling reports about how it's impacting our community. Because we're hardworking, we're contributing to this country's ability to function, but we're all represented in jobs that are essential, and it makes our community most vulnerable to getting sick and dying. Nearly 1 in 3 COVID cases are Latinos. And this is tragic because Latinos comprise about 18% of the total population in the nation. And for children, 45% of all children who have died from COVID-19 are Latino, which is why it is so crucial that we invest in Medicaid, we expand Medicaid, make sure that program is protected because it's such a critical lifeline for our community.
Amen. Wow. Oh, Alberto, that is really critical that we understand the impact and know how it impacts children and families. And you're absolutely correct about this essential worker designation and who it impacts. What a challenge. Emily, can you share with us a bit about what you're working on at this point and what's in your heart?
Yeah, so I think what's in my heart is what motivates me in my job is just thinking about people like Laura and Xiomara and Kristen and her family, and how important health coverage is to them and their families. And so what I do day to day in my job as a health economist is study what the ACA has done for Americans. And unfortunately these days, a lot of it has to do with what would happen to American families if we didn't have the ACA. So first, the good news is that, over the last 10 years, we've seen a historic expansion of health insurance coverage, thanks to the expansion of Medicaid as well as the marketplaces. And today, about 12 million people are covered through the ACA's Medicaid expansion. And in the midst of this crisis, one good thing about it happening today, as opposed to say during the Great Recession, is that there are options for people who lose job-based coverage. They can sign up for marketplace plans and get financial help, and they also have options for Medicaid and for CHIP. And Medicaid isn't just about coverage. I mean, that's certainly an important part, but it does actually result in people getting better care and having a better source for care. For providers in areas that are underserved, they are able to provide less uncompensated care that helps their financial margin. People who have Medicaid, in Medicaid expansion states are less likely to have medical debt, and they're also less likely to be evicted. So Medicaid can affect so many different facets of our lives by giving us, improving our health, but also giving, improving people's financial well-being. So when we think about, what could be done today, amid this pandemic, I think one answer for states, and particularly the dozen states that have not expanded Medicaid, is make sure to support Medicaid and expand Medicaid so that people who are low income have an option for coverage if they don't have it through their job or don't have an affordable option available to them. And I think what's really scary in the next several weeks is this Supreme Court case that we talked about in the first panel. On November 10th, the Supreme Court will be hearing a case which, despite its flawed logic, could overturn the entire ACA. So that means 20 million more people without coverage nationwide. About 15 million would lose Medicaid or CHIP coverage, including kids. If Medicaid is overturned, as well as other parts of the ACA, people like Laura and Xiomara won't be able to buy coverage on their own at an affordable price and might have lifetime limits. There might be necessary medications or benefits that aren't covered by plans, even those through an employer. And this means, no affordable coverage options for people who might have lost jobs and are struggling to support and feed their families during the pandemic. So this could really be a devastating case for families all across America.
Absolutely. I mean, so well said. I'm curious about that intersection of healthcare and housing, but that the economic stability as well as health creates a general benefit to families' lives. That was a new statistic for me. Thanks, Emily. I really appreciate it. And I want to go to this issue, though, of this pesky immigration issue, which is another issue that severely impacts the capacity for the Hispanic community and any other immigrant community to get access to care because of the limitations of the ACA. And Alberto, I wonder if you could speak to it a little bit from the UNIDO's perspective. And Nadia, I wonder if you've got some perspective on the issue for immigrant moms and how that might be, how your constituency might be impacted. Why don't you go first, Alberto?
Yeah, thank you for that question. So UNIDO's US prioritizes making sure that everyone's covered, no matter your status. And so, we've been pushing to support policies that remove barriers to health coverage for all immigrants. And so, there's this a 5-year waiting period in place, for example, for lawfully present immigrants to be able to access Medicaid. Certain states have adopted what we call the IKEA option to expand coverage for the pregnant moms and children. But we need to remove more barriers for more Latinos across the country who come from immigrant families. We talked about the COVID packages recently that we're trying to see move forward in Congress. We've advocated to make sure that there are barriers removed to make sure that our community members are being able to access the resources they need to be able to navigate and respond to this pandemic. So that we push to eliminate barriers to health coverage for the Latino community, particularly those from mixed status and immigrant households. We push at the state level to ensure that our immigrant families have access to Medicaid. And with regard to the ACA limitations that you mentioned, I'll just note that one of our other priorities is the Health Equity and Accountability Act, and within that act there are provisions that would remove barriers for immigrant populations who were banned from purchasing health coverage on the exchange to be able to do so. So there are a number of specific provisions and policies that we've been trying to advocate to remove barriers for Latinos to be able to access Medicaid, but also health coverage on the exchange.
Generally. Good point. Good point. Nadia, does Moms Rising have an experience with the immigrant community also? I know you're such a broad coalition. I'm not sure how you're impacted in that one.
Well, even though with a broad coalition, we definitely have teams that work specifically on either protecting healthcare or immigration. So I work on maternal justice, and sometimes the work does overlap. So our immigration team, for example, one thing we've really connected on is the fact that there was, as soon as this administration came into power, there was a chilling effect and a lot of misinformation put on regarding healthcare to families. I mean, including court cases that were, for us to even explain it was complicated, let alone to understand it. So for example, I know that, like, when Alberto mentioned mixed status families, there were families whose children are U.S. citizens and they're citizens, so they have access to healthcare, and they were not getting the access because of the fear that a parent might be picked up. And you were hearing of stories of mixed status families being approached by ICE in hospitals, or even being picked up and put into detention by ICE. And so that the chilling effect of that definitely impacted families. And even on a very local level, workers were saying that they knew that there are people who could access this healthcare, especially for their children, and they weren't doing so.
Wow. Okay, so this isn't just about who qualifies, but it's also about what happens in the community and how attitudes and the fears in the community can drive us away from being healthy.
Yeah. And I'll just add that, making sure that there are trusted community-based organizations that are reaching Latino communities who are living in fear right now, scared of COVID, but also scared of the anti-immigrant climate that the country is living in right now. Making sure that there is investments into community-based organizations that are working with Medicaid eligible Latinos to make sure that they should get enrolled, that they're eligible for this program, should not be scared, they should enroll and get the coverage they need right now, especially right now during a pandemic. And so I think the trust, making sure that whatever policies we discuss around expanding coverage through Medicaid, getting the word out, that it's done in a way that is culturally responsive to the needs of the community, making sure that information about Medicaid eligibility is done so in different languages, making sure that there are Spanish language information that's available in the community so that they're aware about resources and they know where to go to access information about enrollment.
Oh, that's
can I add? Sorry, this isn't just an anecdotal problem. You actually see this happening in a big way in the census data. Over the past few years, the number of uninsured Americans has gone up by 2.3 million, including 700,000 kids. And these losses in coverage have been disproportionately among Hispanics. So certainly I think our current atmosphere of hostility towards immigrants is very damaging. But there have also been, laws recently, like the public charge rule, which, supposedly are directed at immigrants themselves, but often have a chilling effect on their families and citizen children who are afraid to go get coverage that they're eligible for because they're afraid of jeopardizing immigration status. And these are very damaging policies that hurt immigrants and their families.
Amen. All right, we only have a few minutes left. This goes really fast. This is fabulous conversation. Thank you so much. But I'm wondering, could each of you pick one thing that you would like, if you had your magic wand and you could wave it and change it, what would, out of your study, your work, your advocacy, what change would you make? And whoever's got it first can start.
There's so many systemic barriers that prevent Latino children from being able to access Medicaid and health coverage. So, if I had a magic wand, I would, break down those barriers, make sure that kids get the care that they need, that there's no burdensome process that keeps them from getting what care that they need, and there's no restrictions keeping them from getting health coverage because of where they were born or where they live in this country. So that's what I would want.
My magic wand would be that healthcare be seen as what it is, which is a human right, and not as a political pawn to keep getting kicked back and forth and putting people's lives in danger. And it would be accepted, and everybody who needs it would have the quality healthcare access they need.
Oh boy, I have two arms, so I'm with both of you with your wands. Yes, let's make it happen. Emily, I need a third arm, I'm sure, but
so I wish I had 3 wishes. I would like Nadia's and Alberto's too, and then I think my own really is quite a simple ask, which is that let's stop this lawsuit that could overturn the Affordable Care Act. I mean, I'm certainly, even with the Affordable Care Act, there are gaps in care and affordability that need to be filled so that we have truly universal coverage. But the chaos and devastation of this lawsuit cannot be underestimated. For the 135 million people with pre-existing conditions, it could mean not being able to get coverage on your own anymore. It would mean no coverage and no financial security for millions of Americans at a time when the safety net is needed more than ever.
Amen. Amen. Well, thank you all so much. I've really appreciated your insights, your work. Thank you for your advocacy. And thank you for helping make healthcare a conversation about community and about relationships. Because what I realized, Alberto, in your advocacy, Nadia, in your care for moms and maternal health, and Emily, in your statistics, it's about the whole of us caring for each other. That's what really matters. Well, so to our audience, this election matters. This election matters for healthcare. And as my subtle sign says back here, who we elect matters. So think of this conversation as you go into wherever you're going to be voting this November. Make sure that you consider the stories we heard from Elena, from Laura, and Kristen. Their families are seriously impacted by this. So many families in our nation are impacted by either a lack of access, not being able to create a relationship with a doctor, not being able to make sure that your child with challenges gets full care. And then they're impacted with Nadia's advocacy for moms and the fact of the disparity between white moms and African American and Hispanic moms is shocking. We've got to change that. We've got to change that. Alberto's concern for the Latinx community among us who don't have access to care. We've got to change that. But I think, Emily, you presented the baseline piece. We have to protect the Affordable Care Act and build from there, because we do not want to go backward. It is a human right to have access to care. Within my faith tradition, it's made abundantly clear that Jesus was about healing, and so should we be about healing. We are responsible to each other. So, people, listen up, make a difference. We, the people, can do this. Who we elect matters, and you hold the key to it. So be sure to vote. Vote for healthcare. Vote for creating a more perfect union and caring for the 100%. Thank you so much for listening in tonight. We're really grateful that you're a part of it. Don't forget to vote. We're counting on you. Thank you.